Welcome to our segment on hand sanitization, which is part of our overall series on viral health and safety skills. I'm Julie Swanson, I'm the life skills lady, and I'm joined by Christine Marino, who is a licensed behavior analyst and a clinical director at Milestones Behavioral Services. Welcome, Christine. So glad to have you.
Thank you very much. Glad to be here.
Okay, before we get right into hand sanitization, I just want to say a couple of words. I want to make sure that when it comes to any of the new viral health and safety skills that you're working on with your child or a learner, is that you reach out to your school's special education team and work with them, because it's very important that you're consistent between home and school. Additionally, we want to make sure that some of these new essential life skill goals around viral health and safety could be and should be part of your child's IEP. And it's important so you have that discussion with your team. Additionally, in this segment, we're going to be talking about reinforcement, desensitization, task analysis, and generalization. We have separate videos on all of those principles. And so when Christine gets into talking about them, she'll explain them briefly, but we also have other videos on them. So Christine, having said that, let's dive right in to hand sanitization. And what's our first step?
So the first step is really identifying what your child's capability is to start with. And, there could be a couple of different routes to go. So on the one hand, a student or a child may, have difficulty even tolerating the feeling of the hand sanitizer or the smell of it. And in that case, your goal might be desensitizing them, as Julie had mentioned. What that means is, desensitization is anytime someone has difficulty tolerating like a smell or a sight or a feeling, it's, helping them to tolerate it by giving them very basically small doses of that thing until they're able to do so. And then the other route, if they do have that ability, could be to either teach them to be applying the hand sanitizer independently, or just allowing an adult to apply it to them. Again, you want to kind of think about your goal both in the sense of what is the child able to do, but also that, this is something that is vital right now that we really need them to be able to do pretty immediately. So it's okay if the goal is just to accept help with applying.
Right. And there's plenty of room, plenty of time to perfect it as time goes on.
Exactly.
So great. Okay. And so what about planning ahead? I know you want to talk about that.
Yes, definitely. So you want to think about, the different situations that your child may be asked to use hand sanitizer, would be necessary for them to use it. And, we'll go in even more a little later about why that planning is important. But thinking about, okay, they're going to be going to summer camp or school, other friends' houses, a doctor's appointment, things like that, where, maybe hand washing might not be immediately available and they need to use the hand sanitizer. And that planning is important so that you can make sure that if you're practicing at home, you're thinking about those situations and the different variables in those situations, making sure you're teaching toward that.
And if you're anything like I am, it's making sure that you have it all over the place, in all the different places that you're going to be, because when you need it and it's not there, that's a whole other issue.
Yeah, it could be different. I apologize, but it could be also different, types of pumps, different colors of hand sanitizer, a spray versus a pump. So all of those kinds of things you want to think about. Right.
And so what about practicing at home? We know that we want to bring this to make this a skill that you have in all settings, but and that you're working with your school team, but the practicing at home component of it.
Definitely. So practicing at home is going to allow you a lot more opportunities to practice. So you're not necessarily just waiting for the situation to occur. And that's really important in getting to a child to learn a skill more quickly. The more chance we have to practice, the better or quicker we're going to be able to learn a skill. And also, I think, it cuts down on other variables that might interfere with teaching. So for example, you're in the grocery store and the hand sanitizers right at the entrance when you walk in, but there's a line of people behind you waiting, and you kind of feel, you know, rushed, that you don't really have the time
Right.
to really have the student work through it. So that's why it's important to do that. Additionally, at home, you know, one of the first things you want to do when you're teaching is identify a reinforcer or a reward to give the child when they do it correctly. And, you know, it might be
So could you
easier.
just first briefly explain what reinforcement is, and then people can watch the segment as well?
Yes, definitely. So reinforcement, you can't teach without it. So it's essentially, you know, finding something that's fun or motivating for the child and giving it to them immediately after they do whatever it is that you want them to do. And also making sure that it's consistent, and you're really only giving them the reinforcer when they're engaging in that correct behavior or skill. So they don't get it if they do it incorrectly, they only get it if they do it correctly. And in home, you know, you might have a greater, you know, variability in what you can use for reinforcers. So you can use things like fun activities, a preferred toy or game, or you know, it could be a social interaction or praise. It could be a snack or a special treat. So when you're first teaching a skill, you know, you want to use something that's really powerful and really motivating to the student, and give it pretty frequently. Once you're out in a different setting, you're going to be probably a little more limited with what you can use. And so, but hopefully if the skill is already, you know, in the child's repertoire and they've learned it at home, they might not need the same level of reinforcement. They still may, but, you know, those are some variables to think about.
So can we talk about how you want to tap into the best way that your child or the learner is going to learn, whether that's video modeling or whatever? Let's talk about that, please.
Absolutely. So, okay, so say we're teaching the skill at home. We've identified a reinforcer, a reward that we're going to use to motivate. Now, how are we going to get them to do it? So again, first you want to make sure that your first step, whatever it is that you're initially teaching and rewarding them for, is something manageable. So if this child doesn't have any idea how to apply hand sanitizer, you're not going to begin teaching them every single step and expecting them to do the whole set of steps independently. And that's where task analysis comes in. So Julie, you talked about, you know, referencing that video. It's really just breaking something down into very small steps. So step one might be asking for or going to get the hand sanitizer. Step two, opening the lid. Step three, applying it, and so on and so forth. The ways to get the child to do that, you know, the best way might be different depending on your child, but some different things could be to simply show them. So you do it yourself and then you have them do the step. It could be showing them through a video model, which can be fun for some of our learners because they really like screens, and you know, that could help motivate them. It could be using text or pictures to show them the steps if that's helpful to them. And you know, these are a lot of things that we can use to cue children who have trouble processing language. If your child doesn't have difficulty with that and just verbal instruction can be effective, then that's fine to use too. And you might start off using a certain, you know, method and find that doesn't work and you switch to something else, and that's fine.
So you talked about teaching in small steps, which is the task analysis, and then reinforcing. Now let's talk about generalization, because that's such an important aspect of this. Nobody wants to just be able to have this skill in one setting. And
Right.
this is, again, so important for school as well. I'm sure at school, there's also going to be hand washing, but water and soap aren't always available.
Exactly. And you know, to your point earlier, it's really important to communicate with your team, you know, at school, or, you know, if they're in therapy sessions with other providers, to make sure that everyone is teaching consistently and has the same expectations, because otherwise the child can get confused and that can make learning progress more slowly. So communication is important there. And then as far as generalizing it to, you know, doctor's visits and things like that, Yes, you want to wait till you see you see them reaching the goal that you set for them in the home first, if it's possible. Obviously we're out and about and we have to apply it, but maybe the home expectation is to do it to a certain level of independence. And for now, you're not going to worry about that when you're in the grocery store. You're just going to do it for them, and that's fine. The other thing is, to not be discouraged if the child does really well in the home and then you get to that new setting and they don't perform or they don't do the skill. It's okay. That happens. It also happens that sometimes progress, is going along on a really nice trajectory, and then we have a backslide for a little bit, and then we start progressing again. But skills aren't always learned in a perfect sort of linear fashion. So again, just keep persisting and trying. But it is really important to make sure that the child can apply hand sanitizer, let it be applied in all of those different settings, and not just to assume that they will do so without specific instruction.
Great. And I know we always want to make learning fun. Talk about that real quick.
Yeah, so, again, this is going to be individualized for your child, but some different things you could do is, I know there's different types of hand sanitizer that have different colors and smells, and if they're into that, you can maybe start out by using those. You could put, special stickers on the hand sanitizer, or, like favorite characters and things like that. So just think about some different ways that you might be able to, again, kind of help motivate the student and make it exciting for them to do this.
Perfect. And I think lastly, we want to talk about the fact that when it comes to applying hand sanitizer, or even washing your hands for that matter, you want to make sure that you're doing it in an effective manner, so that the germs actually get killed. And so if you could Google, how to properly use hand sanitizer so it's effective, we certainly encourage you to do that. And having said that, Christine, thank you very much. And we hope that this segment on hand sanitization is helpful to you.
Thank you.
Okay, bye-bye.